what in your experience tends to be the most common side effect that people are dealing with after treatment? And have you learned any tips and tricks to help us kind of manage those?
Yeah, I mean, so basic things. Everybody above 65 gets a growth factor support. Um, if you have somebody with questionable performance status, you can start with our mini chop, so half the doses, close to half. You can escalate with subsequent cycles. I try to cap the vincristine early on if they tell me that the neuropathy is pretty troublesome, even before the pain starts. I cap the vincristine. If you're using Pola, I would dose use the Pola as well. If they get febrile neutropenia despite growth factor support, then I reduce the cyclophosphamide as my first dose reduction to 600 from 750. Um, those are the common things. People with higher cardiac risks, I only do an echo before, I don't repeat it again. Because the reason for this is we always see a drop in ejection fraction if we tend to do it after 3 cycles. The problem then arises is what do we do with this information? Because they're not clinically uncompensated. So it's better not to check unless they're symptomatic and not do an echo unless they're symptomatic.